Welcome back into Everyday Kentucky. We're here at UK Sports Medicine and Orthopedics with Dr. Ali Ahmed, a podiatrist.
Yes.
And my understanding is you concentrate on the ankles and the feet. I had my grandfather tell me one time, if your feet hurt, you hurt all over.
Yeah. Well, I like to tell my patients the feet are only as stubborn as the beholder. So it only goes over so often. But podiatry is a great field. We deal with anything with the foot and ankle. That's bones, joints, skin, nerves, nails.
And I mean, really, if you've got problems with those, it's going to cause you to walk differently.
Yep.
It's going to affect some other joint,
Yep.
and so it all just kind of dominoes from there.
Exactly. The feet are, abused really every single day. We don't even really think about them. I always think about my patients who often work several jobs.
Yep.
They don't have the time to just go home and kick their feet up, and so they don't look at their feet. And a lot of things can go wrong with that.
And in terms of the orthopedic part of it, it's not just athletes. I mean, you see a lot of everyday patients. What are some of the most common things that people see you for?
I would say the main thing that people see me for is arthritis and also heel pain. There's a very common condition called plantar fasciitis.
Duh.
Almost everyone is familiar with it. Half the people can pronounce it properly.
Right.
And it's basically a tightening of one of the tissues in your foot, and that can be quite debilitating.
It's very difficult to treat too. I mean, I've heard everything from people putting those old Coke bottles in the freezer and rolling your heel on them to sometimes you have to cut, right?
Yeah. We like to reserve surgery for if you absolutely need it and you've exhausted all conservative things, but it is definitely one of the options. Stretching, inserts, icing, you have to be very regimented and religious with it, honestly. And I would say most people do well with just those things. But if you need to, we can, pick our brains a little bit further and figure out what we need to do.
Sure, and I think in any kind of orthopedics, but especially involving the ankle and the foot, no matter what you do, no matter how good you are at what you do, it's only as good as the rehab that the patient puts in.
100%. The rehab and physical therapy are such a huge part of our treatment algorithms.
Okay, so the other thing that happens too, I don't know about with ankles, but certainly with feet, because of the high level of diabetes that we have here in this state, I can only imagine some of the things you treat along that line.
Yeah, so diabetic patients, they need everything from just routine foot care, just someone laying some eyes on their feet if they're relatively healthy, making sure there's no cuts and wounds, things like that. Because with diabetes, there's a condition called neuropathy, which can develop, which is basically nerve damage. So if you don't know that something's going on, you don't know to take care of it. So that's how things like infections and wounds and all that sort of start to fester.
And if you have neuropathy and you're a weekend warrior or something, you might think you can get through it with the stretching and things like that, but then at a certain point in time, you've got to listen to your body enough to go see a specialist.
Absolutely, and that's one thing we try to harp on, and they say that doctors are the worst patients too, and so I definitely am a victim of that. I try to put things off, try to take care of things, but at a certain point, if it's not getting any better, I think it's important to get them checked out.
Absolutely. Dr. Ahmed, thanks so much for your time and for everything that you do. Remember, you can go to UK Healthcare/ortho to get more information about Dr. Ahmed and all his colleagues here. And we'll see you next time on Everyday Kentucky.